Right. So thank you everyone for coming to our training on navigating services and mental health barriers for male caregivers and families. And I first want to pass over to our Assistant Vice President, Viviane Ouedraogo, to do an introduction for us.
Thank you, Mohammed. Good afternoon, everyone. My name is Viviane Ouedraogo. My pronouns are she and her. And I'm Assistant Vice President for the Strong Families and Community Training Center. So thank you so much for spending your afternoon with us. I think these conference, the presenters so far on Monday and today have been so good. So I'm really excited to have you all here with us. In a few moments, I will turn it over to our advisors, but first I wanted to give you all just a background on the SFC. So the Strong Families and Community Training Center, which is the SFC, was established in 2019 as a center that offers ongoing training, capacity building, and technical support to service providers, but specifically for those who have family and youth serving peer advocates on their teams. So in doing this, we're using a focus on racial equity training and awareness. So a lot of our trainings are based around that. Through this, the center enhances the advocates to utilize their strength-based approaches, culturally relevant positive parenting, and family support models. And with these services, they aim to strengthen family relationships and empower the parents slash caregivers, particularly those that are from marginalized communities, to promote and to improve the social and emotional health and development of children and youth. The training and technical support that the center provides is on parenting and peer support models that providers will integrate into their work with families, emphasizing on that racial equity principles throughout. So similar models that the SFC tends to fund for providers outside is Parenting Journey. We have offered Circle of Security Protection Parenting. We have also offered Parenting in America. Our most recent one that we offered was for our youth peer advocates, is Spark Mentoring, which is a group model that they can use with their adolescents when they're working through some emotional, behavioral challenges. So we work within the family and youth peer services model. That is pretty much where family youth peer services support services, excuse me. They empower and support parents and caregivers as well as children and youth from birth to 24 experiencing that social, emotional, developmental substance use or behavioral challenges. So majority of our trainings are supporting those providers and organizations throughout New York City and New York State. Or even across US, if you're virtual, with those that are working within the family youth peer support model. So family youth peer advocates provide the following core services. They provide the emotional support, advocacy, and assistance to navigate the child serving systems, information on mental health conditions, services, and family rights. They make those referrals to appropriate services and resources if needed. Skills development and recreational activities for the kiddos and the youth that we serve. So each of our staff within the SFC, they come with lived experience or lived expertise. And in their role in our center's mission, we believe that each of us receive the full knowledge and support to increase everyone's professional development to land in any of these roles within the center if they were to become vacant, internally developing each other and externally bringing in those that also want to be developed within the center. So once again, I thank you all for being here this afternoon, and I will pass this over to our advisors for our navigating services and mental health barriers for male caregivers and families.
Okay, so just once more, my name is Mohammed Irtaza. I'm a youth peer advisor here at the SFC Center, and I use he, him pronouns.
Hey everyone, my name is Scarly Rodriguez. I am a bilingual youth peer advisor here at the SFC, and I use she, they pronouns. And Viv gave a beautiful rundown of what we do here at the Strong Families and Communities Training Center. I do want to highlight that our trainings are primarily for youth and family peer advocates, but they're actually open to the public. So any and all of you can feel free to attend. We do virtual trainings, we do in-person trainings, and they're free and they're open. So we'd love to see you there. At the end, we'll share our contact information and our website because we'd love for you to utilize the trainings that we put together.
Now, just to ensure, this is a safe group for everyone, I will also be looking back and forth because I have multiple monitors. So if you're wondering, why is he looking everywhere? It's because of that. So in terms of our community agreements, one mic. So as Gail said, please keep your mics and cameras off so that way we have a smooth recording. Throw glitter, not shade. So if we have a Q&A portion, this is just to say, please challenge the idea, not the person. The Vegas rule. So if anyone shares any personal stories, we want to ensure that in this virtual space, those stories stay here, but the lessons we learn leave here. And because we are going to be covering a lot of topics in regards to mental health, if you do experience, heavy emotions coming up, strong emotions, I highly encourage you to step back and take care of yourself. So that way you can recenter yourself and then come back to this training. And always, this training will be recorded. So if you need to step away for a while, then you can come back and view the recording instead. In terms of our learning objectives, we are first going to understand the systemic barriers boys and men face in seeking mental health care and the societal factors influencing these challenges. Number 2, identify the various services and providers available to support children and families, including how to access them effectively. And lastly, number 3, how we can develop strategies to empower families and individuals in advocating for appropriate mental health support and services. So for our agenda, first, we're going to talk about the masculine barriers. Second, we're going to talk about how we can navigate service systems. 3, how we can support. And lastly, we'll do a brief recap. So to begin our conversations, we really want to talk about the masculine barriers and oftentimes how boys and men, what barriers they can experience. And though this list is not encompassing everything, these are just some things we want to highlight. So one of the things we want to highlight is the shameful gaze. Now, shame is a very strong weapon and it can be weaponized by anyone because it doesn't necessarily require physical violence. It can really inflict a lot of mental and emotional violence, specifically for boys who act out of their patriarchal gendered norms. So, if a boy is expected to play with certain dolls, if they're expected to behave in a certain manner, oftentimes you don't need violence to bring boys back in quote unquote order. You could just shame them because it is a very strong emotion. And it's a very powerful experience because no one wants to be isolated. No one wants to be, excluded. And I do want to emphasize that with gendered norms, they're not always, forced, but they can be strongly suggested, especially how, if a parent exclusively provides boys to, only soccer or only sports or only certain type of activities that they can do, they may not actively be forcing their kids to act in a specific way, but they are strongly suggesting them. So it's not always an overt, in your face type of, way that parents may have boys act out. And with shame, we also want to realize how it affects navigating relationships. Because if a father's love is seen as conditional, a child feels like they have to work for it, while the mother's love is unconditional. So if they have to work for their, father's approval, for their love, then it can create a lot of emotional turmoil within the child. And then we have to take into account, as the child is growing up, as the boy is growing up into be a father, they may not have the emotional tools to be that father. They may even utilize, shame as their tool for ensuring, the boys stay in line. And it is also important to note that if men don't have a loving role model, then those emotional tools, they don't just come naturally, they are learned. And then we also have to take into account how trauma also plays into all of this because exposure to trauma can cause serious emotional harm and unhealthy behaviors, such as unhealthy coping mechanisms, such as using substances or engaging in violence as a way to experience, relief from stress or any sadness that a young man or a father might be experiencing. Next, we have to look at how all of this now goes into the mental health challenges that men experience and how this might manifest. Doesn't necessarily have to manifest in this way, but it can manifest in this way, in that men may grow up to have low self-worth. They may feel, unconfident and motivated. And when we realize, the factor of poverty can also be traumatic, and if a man, is not earning well, if they're not providing their, families well enough, because they're experiencing poverty, they may feel like they're not a man enough. So they're not living up to the ideals that they were taught on how to be a man. And this can cause, oftentimes this can cause sadness where, men are hiding their sadness. They feel stressed, but they're not really uh, expressing that stress, or the anger becomes the default emotion to express that sadness or that stress because they're not taught how to express those emotions properly. And how this can affect men is that communication, especially when you're navigating relationships, can become hard. So if you have, any arguments or if you have any serious talk, this could lead to, shouting or even just shutting down, because if you're experiencing strong emotions, but you don't have the proper tools to express them, then it can really limit on how you can go about speaking to not only your partner, but even to your own children. Because again, we have to take into account, if a father is utilizing shame or if they're not speaking to their child at all, we have to take into account what that boy is learning and the emotional tools that they're taking with them into adulthood years. And emotional neglect is also important to emphasize because shame, not only shame, but emotional neglect is a very strong tool because it makes boys feel and men feel numb and disconnected from others. And that isolation is very toxic when I'm trying to understand the mental health challenges boys and men experience. So next, we're going to be talking about how we can navigate systems. And this is important to realize because this is connected to the mental health challenges boys and men experience, given that we want to ensure that the material reality that boys and men are navigating supports the mental health journey that they are going to embark on.
Yes. So, as Mohammed said, there are many systems that male caregivers navigate, and I want to name some of the biases that exist within these systems, as well as provide tips for navigating them. So, in the education system, we know that boys face bias through higher discipline rates, lower literacy support, and they have fewer male role models since the teaching profession is predominantly female. And then when it comes to male caregivers and fathers, they're often excluded from school communication and decision making due to societal assumptions that mothers are the primary caregivers, leading schools to default to communicating only with the mother, especially in separated families. So, how male caregivers can advocate for themselves and their families in education systems. So, they can build strong relationships with teachers and school administrators by showing up and actively engaging in IEP meetings, individualized education plan meetings, by asking questions, taking notes, and advocating for their child's needs. They can learn the language of special education policies and understand the Individuals with Disabilities Education Act, everything that is covered there. And this can empower fathers to be seen as equal partners in their child's learning journey. And I would also encourage, don't wait for the school to reach out. Request an evaluation. If you see that your child is struggling, you can be proactive in making sure that they have accessible tools for their learning. And when we think about the healthcare system, some things that men and fathers are up against is that men's mental health and preventative care are often overlooked due to stereotypes of stoicism. The societal pressure for men to be tough and stoic discourages them from acknowledging emotional struggles or seeking help. And it's proven that men are less likely to be screened for anxiety and depression despite having significant rates of these conditions. Also, fathers receive little reproductive or parenting health support due to that same historical and societal focus on mothers, a lack of father specific services, and those gendered societal norms that position caregiving as a primary female role. And so in this system, we encourage men to stay engaged by knowing their coverage, tracking care, asking questions during visits. They can actively participate in their care by advocating for themselves and their families. And that includes managing medical care by keeping organized records, learning the details of their insurance coverage, and preparing questions before appointments. And this proactive approach helps them confidently advocate for their child's access to specialists and necessary treatment, and also for themselves. Because, men, we want to emphasize that you matter and your mental health matters. So you get to prioritize that just as much as you prioritize the mental health of your children. In the legal system, we know that fathers face custody bias, punitive child support enforcement, and they also face disbelief as abuse victims. And we know that men receive harsher criminal sentencing than women on average. So, in this system, we encourage male caregivers to understand custody, guardianship, and disability rights laws that can help male caregivers make informed decisions and protect their family's interests. And seeking legal aid or consulting a family law professional early can prevent confusion and ensure that you know your rights and responsibilities. It's important not to wait for a crisis to access these legal services. In the social services system, which includes accessing housing assistance, food programs, and other family support services. Sometimes these programs themselves can center on mothers, assuming that fathers are absent or secondary. So we encourage fathers to use local resource centers, coordinate with caseworkers that can help them access services across systems, and advocate for inclusive services because this can strengthen your families. And you need these things: housing, food, childcare assistance. So, building those connections with local agencies and social workers can help overcome stigma and ensures that your family receives the full range of available services. So, the common threads of the biases that um, men and male caregivers um, are subjected to in these systems is that masculinity norms can discourage help seeking and emotional openness. And oftentimes, these systems equate parent with mother, excluding fathers. And there's outdated policies that sustain these gendered assumptions and inequities. But we have some practical tips for you as caregivers. We encourage you to break it down, take one system or task at a time in order to avoid feeling overwhelmed. Also seek clarity. If providers are speaking in jargon and you don't understand, please ask for it in plain language because professionals are used to explaining and you get to understand every single part of your care. Also, build a support network, which we're going to go into later some more. Connect with other male caregivers. Shared experiences can make systems easier to navigate. And take care of your mental health. Please, please, you matter. System navigation is stressful, and recognize when you need a break or you need professional support. So next, I'm going to go into some of the services that, if you think of just as a plant needs consistent care to thrive, these are the services that provide the steady watering of resources, support, knowledge required to nurture your potential and to help you and your family bloom into your best selves. So, with mental health services that are provided by therapists, counselors, psychologists, and psychiatrists, we really want to encourage you to take advantage and prioritize mental health because it supports coping, stress management, and family well being. And we know that More often than not, men may avoid therapy due to the stigma around vulnerability. So, we encourage you to try different therapy options until the right one, the right fit, and even after several appointments, if you feel like that trust is not there, we encourage you to try different providers. There's group therapy, family therapy, individual therapy. There's a bunch of different kinds. So we encourage you to try them out because you deserve relief and you deserve support around your mental health, just as your child does. With education services like IEPs, 504 plans, and tutoring, these are the services that ensure academic success, especially when we need academics to be accessible to our children and we need those additional tools. We know that often in schools, boys face behavior labels, and also, like I mentioned, fathers are often left out of school communication. So, male caregivers, we encourage you to initiate meetings and advocate early for your children. With health services provided by pediatricians, specialists, and those early intervention programs, those occupational developmental programs, and those language programs, we really want to emphasize that early intervention services support long term health. And because of socialization, sometimes men can assume self reliance and think, we got this on our own, we don't need support, so they may delay preventative or parenting care. So we encourage you to seek those services, stay organized, and also ask providers about additional referrals. Like, what else might you suggest so that we get the full range of care that is available to us? With community resources like after school programs, youth programs, and community based organizations or CBOs. These are the programs that build connection and structure. And, sometimes these programs can center around mothers and they might leave fathers feeling excluded. And we encourage you to get involved locally, seek free or low cost options, and again, utilize the things that are available to you because you deserve to utilize them. With social services, again, fathers are up against that myth that they're absent or undeserving of aid. And, those supports are the housing, food, and financial supports that stabilize families. So, our tips for you are to apply early because wait lists can be long. Request a case manager or even a care coordinator so that you have that support and allyship. And of course, we always emphasize peer advocates are great supports. And also change your mindset and view support as strength because it's not weakness. Seeking help shows strength, and overcoming bias and connecting across systems is what helps families thrive. So, where do you start when you're seeking services? So, the very first place is to identify your family's needs. And you may look at your family's needs in these areas of academic needs, emotional needs, health, and social support. And something that we know is that sometimes boys' behavior is misread as defiance and the father's input is undervalued. So, male caregivers, we value you and your input. And you can start by taking an active role in recognizing the family's academic, emotional, health, and social support needs. You can create open conversations at home and with professionals to ensure that no area of support is overlooked. You can track patterns for yourself and document because if you document these needs, it'll be easier to communicate clearly with professionals later. And you can ask yourself, is my child feeling supported in school? Do they feel safe and do they feel emotionally supported? Are Is their health, physical, emotional, mental health being provided for? Do we have supports as a family, natural supports and community supports that are really making a difference in our lives? So first you do that assessment. Then you also research service providers. Fathers can compare service providers by looking at reviews, qualifications, services offered, treating it like any other important decision-making process where doing your research up front leads to better long-term outcomes for your family. And, choosing a qualified provider who understands family dynamics and the children's needs. And, you know, if fathers are treated as less engaged when seeking help, that's something that they're up against. But I encourage you, male caregivers, to interview providers and select those who feel collaborative and respectful. There's also the consideration of accessibility. Location, is there transportation support, is it accessible, do they have flexible hours for working parents like weeknights or weekend hours, is it cost effective, do they offer sliding scale, is there interpretation available so I can make sure that language access is provided for. We want to make sure that you choose the fit that for the family's daily routines really makes sense. So again, ask for flexible hours, ask for telehealth options and virtual options if that's more convenient for you, and financial assistance. And of course, provider compatibility is everything. So you want to make sure that your provider is culturally sensitive, because sometimes men and boys of color, especially, may experience stereotyping or cultural misunderstanding. So, providers who you can tell have that cultural sensitivity, respect, and understanding. You can also prioritize your comfort and communication as key factors in care. So obviously providers who respect your background, values, and communication style. And you always have the option to reassess after a few visits. You're not feeling that trust is being built, you're not feeling comfortable, find a better fit. You can always do that. So the key message I want you to take away is that you are the expert on your family, and having that awareness of bias, clear communication, and self advocacy can help you build a network that fits your family's reality in every way. And in this next slide, I want to talk about the family needs assessment. And the point of it is to identify the family's strengths, needs, and resources to create a plan for support and services. And when you're an advocate or a service provider and you're helping a family fill out this assessment, the first thing is to build trust and connection. So you want to establish that rapport through your presence, through your empathy, through active listening, and you can reflect back to them, what they share. Use open-ended questions to understand challenges and strengths. Remember that when families feel seen and respected, they're more likely to share their real needs. And when you're creating a plan for families and taking this needs assessment, you want to help them identify and prioritize their needs. So you're going to explore the key areas of finances, housing, health, childcare, and emotional support. Identify what's working and where the gaps exist before rushing to solutions. And help families rank by urgency to make next steps clear and manageable. And of course, it's a collaboration with families. Obviously, it's important for them to be involved in choosing priorities and action steps. Ask what feels most important and offer support options that fit their goals. Shared decision making fosters ownership, confidence, and lasting engagement.
And with that, we also want to emphasize, the importance of organizational tools. So as Carly was mentioning, as fathers and families, as they're navigating these multiple systems, we want to ensure that, everyone has the strategies to organize their vital documents, especially when they are making those early intake appointments to go to a service provider, do the fill out of paperwork, and, you come to the point of, I don't have certain documents or I don't have this certain information, and we don't want the service to be blocked off in any way because we don't have those documents. So speaking with fathers, especially seeing, how is their working schedule looks like. Do they have the time to store either physical or virtual documentation? Can they have quick access to it? And, also ensuring that they are secure, and also doing role-playing scenarios. And this is really important because we want to really model out how certain interactions might be when fathers are applying for services. So if they go to their medical provider or their therapy provider and they need some certain documentation, even scenarios such as those, you can do role playing and, have them feel it out. How do you feel about, asking this certain question? Do you want to rephrase a certain question, or just have them be comfortable asking those questions in the first place? Because we want to ensure that not only parents have the documentation, but they also feel comfortable asking for their rights. When navigating certain systems, we don't want fathers to just see it's just a given of, oh, they'll tell me what it is. Service providers are navigating a lot of certain, things on their own time. So we want to ensure that fathers and families have the tools to not only store the documentation, but also feel comfortable asking and doing the things that they need to do on their own time. Now, how can we support them? So in regards to, for boys and men, we really want to, again, emphasize the importance of community building. And this could look like such as young men leadership groups or mentorships, because we want to ensure that boys are not only being told what not to do, but also being shown the alternative of what they can do. So that way we can promote healthy and non-toxic masculinity. We don't want to just leave a void in terms of, okay, this is what you can't do, and then not give them any alternatives. Boys, they tend to have a lot of energy. So, we want to provide them with alternatives and options where they can utilize that energy, that creativity in an effective manner. And a support network is really needed because, and this is a line from Bell Hooks in one of her books, she mentions that if boys can't emotionally isolate themselves, they can count on others to do so. And this is really to say that even if in a family where you might have a healthy family, we still have to take into account that oftentimes other boys and men, they themselves can also utilize shame. They can utilize, emotional violence, mental violence against boys who are acting out of the patriarchal gendered norms. And we want boys to be comfortable around other boys and men, specifically being able to say, I don't feel safe around you, so I'm going to step away and find other people who I do feel comfortable with. And this could be other boys and men. And goes back to why, leadership groups and mentorships are vital, because in addition to those groups, we also have support groups. We want to ensure that boys and men are able to open up about their struggles without judgment. I want to highlight that during Monday's session, one of the presenters talked about how, going to areas where men can do, certain activities together, and even in those spaces, they're able to open up. So it doesn't necessarily have to be a, sitting in a circle talking about their struggles, because first, again, we have to take into account that not all boys and men are equipped with the emotional tools to express those emotions, to express those feelings in a way that doesn't make them feel uncomfortable or doesn't bring up so much strong emotions that they can't talk about it at all.
So, how do you build a support network? So, these are some people that might be part of your support network and some of the places you might look. So, peer advocates, people who have walked a similar path, other male caregivers, or individuals who've navigated similar caregiving and mental health challenges. Their key role is that they offer understanding and validation that professionals alone might not provide. And hearing "I've been there too" can reduce isolation and stigma, especially for men who may hesitate to discuss emotions or stress. You also have case managers, trained professionals, often social workers or care coordinators who help families navigate complex systems, healthcare, financial aid, mental health, and community resources, and they act as connectors and advocates, ensuring services are not only available but accessible. Male caregivers often juggle work, family, and care duties, so having a case manager reduces that burden of figuring it out all alone. And asking for a case manager is not a sign of weakness. It's a proactive way to manage stress and stay organized. And as Mohammed mentioned, we have support groups as an option, which are structured or informal gatherings, and they can be in person or virtual, that provide safe spaces to share stories, frustrations, victories, and they promote connection, emotional relief, and skill sharing amongst people who face similar caregiving realities. For men, this can counter the isolation and social stigma that sometimes discourages emotional openness. So remember that you can start small, you can reach out to one peer, ask about case management options, or attend one support group meeting. It's all about strengthening resilience and ensuring that as caregivers, you don't carry the load alone. And I also want to discuss, of course, no one should have to navigate caregiving alone, like I said. And parent networks and peer groups, they're about connection, finding people who get it because they're walking a similar path. And these are the communities that remind us that asking for help and sharing experiences are powerful acts of strength. So, parenting networks are local or online groups that bring parents and caregivers together around shared experiences, whether that's raising kids with special needs, managing mental health challenges, or balancing caregiving and work. And they matter because they provide that belonging and validation. I'm not the only one going through this. And they offer mutual aid, emotional support, and shared resources, and even practices like childcare tips or how to navigate systems. And these networks can become your village, the people who lift you up when you need it most. And you can look for these networks through schools, hospitals, local nonprofits, or faith based organizations. We also have online communities like Facebook groups, Reddit communities, or dedicated caregiver forums. And this is an accessible way to access community because it's accessible anytime, especially for busy caregivers or those in rural areas. And it's a great way to get some quick advice or encouragement from people across the country or even all over the world. Though we do caution you that not all online information is accurate, and you can double check with trusted individuals any advice that you get, and protect your privacy and share only what you're comfortable sharing. But online communities are great. They can be your lifeline on hard days and the reminder that others understand and they've been there too. And then local peer support groups are great because they offer that in person connection, that safe, judgment free space to talk openly about shared experiences. And, they also provide accountability and that encouragement to keep going. And they help normalize discussions about parenting struggles, mental health, especially for fathers and male caregivers. And if you can't find a group near you, consider starting one. Even one or even two or three parents together meeting regularly can grow into a strong network. So remember, connection is healing. Every conversation, every shared story, every piece of advice passed between parents helps lighten the load. And the goal isn't to be a perfect parent, it's to be a connected one. There are also online directories, which, when families need help, sometimes the hardest part is knowing where to start. And there are so many systems and services out there, it could feel overwhelming to find the right one. So that's where online directories come in, powerful tools that make it easier to locate the services and support that your family needs right when you need them. So there are find help platforms. Websites like findhelp.org or 211.org are great starting points. They're basically one stop hubs where you can search for local resources like housing support, food programs, healthcare, transportation, even childcare, mental health services. You just enter your zip code and it pulls up programs nearby. These platforms are updated often and they can save you hours of phone calls and searching. I always encourage caregivers to bookmark these sites or save them in their phones. So when a challenge pops up, you already know where to look. Then there's also local community-based organization directories or CBO directories, and they're often run by local nonprofits, family resource centers, or city agencies. And these directories are especially helpful because they list programs designed for specific populations. For example, fathers groups, immigrant families, parents of children with special needs. And the people behind these local organizations really understand the community, and they can often connect you to multiple supports at once. And finally, let's not forget about our mental health hotlines. Services like 988, the Suicide and Crisis Lifeline, are available 24/7 and they're free and confidential. And in some areas like New York City, where we are, there are local options such as NYC Well, which connects you to mental health professionals, crisis counseling, or referrals for ongoing support. Even if you're not in a crisis, these hotlines can help you figure out what next steps to take or where to turn for help. So the goal here is simple: to know where to find help before you're in a crisis. Having these directories in your back pocket means you don't have to face challenges alone. The resources are out there. It's about knowing how to reach them and remembering that it's okay to ask for help.
Okay, so we talked about a lot of stuff within the short span of time, so we're going to do a quick recap. So when we're supporting, boys and men, and specifically fathers, we want to identify specific areas where a family requires assistance. So it's not just a matter of where the boys require assistance, but also where fathers require assistance. And also seeing if a peer advocate can be provided to both the youth and to the father. We also want to help help families prioritize their critical needs. And with that, we want to collaborate with them so that they can find and decide which suitable services works best for them. Then we also want to keep in mind that boys and men often struggle with emotional expression and communication due to external and internal pressure. So the internal pressure could be the internal sadness or stress that they're bottling up. And then there's the external pressure in terms of the expectation or the suggestions on how boys and men should act. And with that, we can counter it by building supportive communities, offering mentorship, promote healthy masculinity because we just don't want to tell boys and men what not to do, but also give them the alternative, and also create safe spaces for healing, connection, and growth. Then we want to conduct research and networking to expand available resources and partnerships, because what oftentimes works best for one father and one family will work for others as well. And lastly, as service providers, we want to follow up and build relationships with the fathers and the families we're working with, because we want to ensure that they receive the continued support so that way they can have continued progress. We don't want our services to be a transactional one where they just come in and then they leave. We want to let them know that we are part of the community and the service social support that we are offering to them. And with that, thank you so much. Please take some time to do our post training assessment just to give us feedback on, what worked well, what didn't work well.
Mohammed,
Yes,
you have 15 minutes. Do you want to open it up for questions?
yes, please. So
All right.
please come off of mute. Let me see your lovely faces. And if you have any
Yay.
questions or concerns, please have them included.
Let's put our cameras on so our New York folks can see us. And take your mics off of mute.
I'll also include our contact information here. So it is our email, the general email we have. We also have an Instagram, so that way if you're ever in New York City, please check out our Instagram to see if there's any upcoming events that you can partake in. Bradley, you had your hand raised up?
Yes, in hearing all of this has been a very wonderful presentation, but I was curious how you handle the male influencers of social media that are like I'm trying to describe this but like the Andrew Tates and the super like
Mm-hmm.
really toxic dudes. If a well, let's say a kid comes to you spouting
Mm-hmm.
some of these beliefs, how do you then how would you navigate that?
So I actually used to work as a peer advocate myself, a youth peer advocate specifically. And one of the things I would do is really provide alternative, media and, resources to boys when they are in those, spaces, because I do understand what you're saying, because unfortunately those influencers, they do have like a strong voice, but as peer advocates, I think it's important for us to model the behavior and also have them question, how do you feel, engaging in those behaviors? Do you like doing, being aggressive all the time? Do you like, seeing, not only your siblings, but also other women and young women just seeing as like objects? Does that make you feel good? Like really in a non-intrusive and non-judgmental way, holding those conversations of how does do the behaviors and the actions that are being told to you, are they really beneficial, or are you just, following a trend? So really having those non-judgmental conversations, but also modeling the healthy behaviors that they can follow themselves. Thank you for that question.
Yes, thank you.
And I've also included the post assessment link in the chat if you're unable to use the QR code.